Ողջույն հարգելի հեռուստադիտողներ, այսօր ես մեր տաղավարում ունեմ հյուր, California Cardiac Institute-ի Dr. Paul-ն է, նա ավարտել է Harvard Medical School-ի Massachusetts-ի General Hospital-ը, սա համարվում է Միացյալ Նահանգների ամենահին կառույցներից մեկը բժշկական բժշկության ոլորտում առհասարակ եւ այսօր մեզ համար պատիվ է հյուրընկալել Dr. Paul-ին. Hello Dr. Paul, thank you so much for coming. Thank you for your time. I know you are very busy nowadays and I know you moved from different community to our Armenian community. You work in Glendale. How do you feel here?
I love the community, and thank you for having me here today. I must say I've practiced in a lot of different communities, and the warmth, the caring, and the empathy that I see with the Armenian people is just so beautiful. I just love it. Yeah.
Where do you work? Where did you work previously? In what communities?
Right. I worked on the East Coast and most recently, and I must say I would have 90-year-olds come in alone.
Wow.
80-year-olds come in alone, completely alone, and it's just so sad to see. And here, I never see that. I always see a daughter or a son accompany their, parents, and it's just so beautiful. And they're so caring, not just accompany, but just want to get involved, want to understand what they should do and what they shouldn't do. And it's just so beautiful. I just love it.
Thank you so much for your opinion about our community, about Armenian people as well. And just can you provide some statistics? So many people have issue with the heart.
Yeah, in just the last few months, I have seen that the patients that have been at the clinic, they do have a lot of risk factors, cholesterol, diabetes, high blood pressure is very prevalent as a risk factor for the patients that I've seen.
And the season as well, right? So now the season is not good. Am I right? Or it's just a knowledge?
Well, it is Heart Health Month, so I want to make sure I communicate to everyone listening that it is important to go and get a complete cardiac checkup. Find out what your risk factors are, how bad they are, and usually when you catch it early, you can fix it with medicine and lifestyle, and you don't need to have surgery, and that's important. We can keep you out of the hospital, out of the procedure room if you take action early and really get a checkup, do the necessary changes in supplements, diet, lifestyle. Sometimes medicine is essential, but if you take it early, then you can prevent the complications.
So is this your best advice to healthy people or to the people with the problems?
I think it's a good advice for everyone. It's important to really assess your risk at least once. Find out, what risk factors you have and, where you stand with your cardiovascular risk. American Heart Association suggests that at the age of 20, you should go ahead and get your cholesterol panel done, or sooner if you have a family history. So how many out there have really done that at that age? And, if you're older than that, if you have any risk factors, definitely need to go in and get a complete cardiac checkup.
Every year, right?
It's a good idea if you have risk factors to do an annual checkup, definitely, because you want to manage that risk so it never gets bad enough that you need procedures or you need more advanced care or hospitalization. Yeah.
Okay. Thank you so much for your time. Thank you for coming. I hope to see you here again next time.
Thank you. Thank you for having me.
Այսօրվա համար այսքանը, հարգելի հեռուստադիտողներ, շնորհակալություն ուշադրության համար եւ ցտեսություն։